my YouTube channel. Today let's learn about the resectoscope. I have been thinking a lot about this resectoscope because this is something which is really valuable for gynecologists. We can use the resectoscope in infertility, we can use it in the reproductive age group, and then in the peri and postmenopausal age group. Any procedure which can be done inside the cavity, we can do it with the resectoscope. Now you may ask me, can't we do it with office? Can't we do with the instruments which we are using in office hysteroscopy? Yes, we do use office hysteroscopy, but it is a very limited indications, like if there is a small polyp you can remove, you can understand the endometrium, you can remove a foreign body, or if there is a very small myoma, maybe you can remove it with scissors. But what about those myomas which are more than 2.5 to 3 centimeters? What about those septum which is thick through and through, where using scissors is a big challenge? And what about those uterus which you want to save in a woman who is heavily bleeding in the age of 38 to 40 years and she has completed her family? And also for a lady who has a very large polyp and you can't use your scissors to remove that polyp or slice that polyp. So for all these cases, we can use the resectoscope. So the art of resectoscopy has to be learned by every gynecologist. Now you may ask me, how do we learn this art? First thing is you can come for training with me, and then how do you practice? You practice this either in a pig's bladder, or after you people do a hysterectomy, keep that specimen, don't cut that specimen, and you use this resectoscope to learn the resection of the endometrium, or if there is a small myoma or polyp inside, remove that. Then what can you do to learn even more advanced resectoscopy? You can also get a cow's heart and then learn the resectoscopy as we do in different training centers. Okay, you are a complete vegetarian. You want to learn resectoscopy. Use a potato. You keep the potato and then you resect inside the cavity of the potato using this resectoscope. So there are different methods where you can learn the art of resectoscopy. Okay, you have learned the basic. Now you want to do resectoscope or use the resectoscope in a patient. Suppose you are doing a diagnostic hysteroscopy for a woman who is bleeding heavily. Just take your resectoscope and one strip you take for you to get a hands-on training on resectoscopy. So there are different methods to learn this resectoscopy and using the resectoscope, but do not give up this art because this is a wonderful instrument and everyone should know how to use the resectoscope. Now you may ask me, what are the different available resectoscopes in the market? We had this conventional resectoscope, and you have the 4 mm hysteroscope which is inserted inside. There is a inflow and there is a outflow. The inflow is always towards the camera and the outflow is always away from the camera. And then once you assemble it, you use the light source here and you fit the camera here, and your resectoscope is all set to be used. You can see the lobe which comes out, and then you take a strip, and as you are removing the strip, pull the resectoscope out. This is how a basic resectoscopic move is done. So this is the conventional ones. And now to improve the efficacy of the resectoscope or to use this in infertility, this is a smaller resectoscope. This is 24 French and this is 18 French small resectoscope with a 2.9 mm hysteroscope which is inserted, and We will show you the assembly to see how it is made smaller, and it has an inflow and outflow, and then you can see the loop with the tiny loop which comes out, and or the tiny Collins knife which comes out, and you can do small septal resections, or a septum which is through and through also you can resect with this small or a mini resectoscope. And the only disadvantage here is the vision is compromised and you require a lot of skill to do this. So first learn your resectoscopy the conventional way, and then come to the smaller ones or the miniature resectoscope. After giving you a brief introduction about the resectoscope, now let's come to the parts of the resectoscope. Now the parts of the resectoscope and assembly is a little complicated, and that is why people don't want to know more and more about the resectoscope. Now in front of me I have two kinds of resectoscope. This is a thin resectoscope and this is the conventional resectoscope. When I say it is a thin resectoscope, it is the 18 French, the smaller resectoscope. It was devised by Dr.Vidya, and you know that this has a 2.9 mm hysteroscope, which is a very small hysteroscope. This is normally used for office purpose or also for patients who are infertile and when the cervical dilatation is not necessary. And for the resectoscope there is a handle. This is how you work with the handle. So this can be tackled differently with of course a proper assembly. So this is how you do your movements with the handle of the resectoscope. This is the inflow channel. It has the inflow pipe and the outflow pipe. So this is the inner channel and this is the outer one. And this is the outflow where the fluid is sucked in, and then you have the different electrodes. The electrodes are attached to the innermost working element of the resectoscope, and you have a loop. You see a very minute loop here, and then the Collins knife which is in the shape of L, and then you have the different electrodes. The electrodes are attached to the innermost working element of the resectoscope, and you have a loop. You see a very minute loop here, and then the Collins knife which is in the shape of L, and then you have the different electrodes. The electrodes are attached to the innermost working element of the resectoscope, and you have a loop. You see a very minute loop here, and then so when you use these for either a removal of a small myoma, or in case there is a small septum, you can use this. And this is a hybrid resectoscope. Now when we had resectoscope, I spoke to you that there are monopolar and bipolar resectoscope. Now the next level is, the next advantage is you have hybrid resectoscopes, so that if your electrosurgical unit is not compatible with your bipolar, you can always go to switch on to the monopolar resectoscope. Only thing is the fluid which you are using will be different. That is, if you are switching over from monopolar to bipolar, you have to switch over from glycine to normal saline. So when you use, or from normal saline to glycine, if you are switching over, that is from bipolar to monopolar, the fluid also changes, and this has to be compatible with your electrosurgical unit, the cautery. Now the conventional resectoscope. The conventional resectoscope has the conventional hysteroscope, that is the 4 mm hysteroscope, and then you have the working element. This is the working element, and with the click, this working element has the electrode which gets in, and once you assemble the working element. You look for the movement of the working element, and the working element has different electrodes. The U shaped, that is the loop, then you have the roller ball, and then the Collins knife. So these are the different electrodes which you use with the working element. And then of course you have the inflow and the outflow. This is the inflow with the arrow in that. For the outflow there is an arrow which goes out, and for inflow there is an arrow which comes in. And then this is the outflow of the resectoscope. So these are two different resectoscopes available. This you can use for office purpose, but of course with caution, because small pathologies you can use, but the patient has to be comfortable. So always keep a standby anesthetist. And this one is a conventional resectoscope, wherein you use it under anesthesia. That is, you have a thick long septum, you have a myoma which is about 3 to 4 centimeters, you have a polyp which is huge and you can't reach the pedicle, so you have to cut it into slices and remove it, and of course transcervical resection of endometrium. Then the other advantage is there is an adenomyocyst sitting inside the uterine cavity that can be tackled with the resectoscope. We will be showing you the assembly of the resectoscope. As you assemble the resectoscope, first you fit in the inflow and the outflow tubes, and then the working element. Now before aligning the working element in the resectoscope, put your working electrode, that is the either the ball or the Collins knife. And once you fix it, the resectoscope is complete to work, and then you put your hysteroscope in the end. And once you fix in the hysteroscope, the resectoscope is ready for use. Then you fit the camera and the light source. So once you fit these two, you're all set to work with the resectoscope. The assembly of the smaller resectoscope, that is the Gubini resectoscope or the thin resectoscope, is a little different, because the hysteroscope gets into the working channel to make it smaller, whereas in the larger one it is separate. So here you can see the hysteroscope which just gets into the working channel, and then the assembly of the inflow and outflow takes place. So this makes the size of the resectoscope small, and once you fit it, it is all set to work. So you have to fit in the hysteroscope and the working channel or the electrode together, and then you fit in the inner and the outer channel.